A very warm welcome to all to my channel Mission NEET-UG. In this video, we shall be discussing about different digestive disorders which are caused due to improper functioning of the digestive organs. This is an important topic with respect to the subjective exams of class 11, and many subjective questions are being asked from the similar topic. So the first digestive disorder which we shall be discussing is jaundice. It is a condition which affects liver, skin and eyes due to the deposition of yellow colored bile pigments. Also, there is presence of excessive bilirubin in blood which cause its deposition into the skin. Also, it is of two types, obstructive and hemolytic, which we shall be discussing in the next slide. So, talking about the jaundice, the liver is affected, skin and eyes turn yellow due to deposition of the bile pigment. There is excessive presence of bilirubin in blood and its deposition in skin, mucous membrane and sclera. Basically, the appearance of the person affected with jaundice turns to be yellow. They give yellowish appearance, the skin gives yellowish appearance due to the deposition of bilirubin into the mucous membrane and sclera. The patient has yellow appearance, which in medical term is known as icterus. Urine of the patient appears yellow while stool may appear pale. Now this is a very distinctive feature of a patient suffering from jaundice to that of a normal person, that the urine of that patient will appears to be yellow, but on the other hand the stools may appear to be pale in color. Jaundice can be obstructive or hemolytic. Now when we say obstructive, that means there is some problem, some obstruction in the pathway of bile. So in obstructive jaundice, there is a non-flow of bile from liver to duodenum. We know that whenever the bile is produced, it travels from liver, from the gallbladder towards the duodenum. But in obstructive jaundice, the flow of bile from liver to duodenum is being obstructed. The second type is hemolytic type, which is related to the blood. There is problem in blood, and the problem, it says there is excessive degradation of the erythrocytes. Whenever the erythrocytes, the RBCs will degrade in much more number as compared to the normal numbers, that will lead to hemolytic jaundice. The second digestive disorder which we will be discussing here is vomiting. Now this is a very common digestive disorder which every one of us must have experienced at least once in a lifetime. So when we say vomiting, what is vomiting? It is the forcible expulsion of the content of stomach through mouth. So whenever there is forcible expulsion, the content of the stomach just comes out with extensive force through mouth is known as vomiting. The cardiac sphincter and esophagus relax so that they can make a pathway which is created from stomach to outside. Now as we know that there is a forcible expulsion of the content of the stomach, so whenever the content of the stomach tries to come out from the body, the sphincter, the cardiac sphincter, which guards the content to prevent it from backflowing into the esophagus, that will relax. The esophageal sphincter will also relax so that there is a pathway through which the content which is to be expelled out of the body can travel from stomach through our mouth and then towards the outside of the body. There is contraction of abdominal muscle as well as gastric muscle. So whenever there is expulsion, we can feel there is a strong contraction in the abdominal muscle around the stomach and also by the gastric muscles. Vomiting is controlled by vomiting center of medulla oblongata. Now we must know that medulla oblongata is a part of our hindbrain and it controls all the involuntary actions by our body. So vomiting is basically an involuntary action where the body is trying to get rid of all the waste or all the undigested or all the unwanted content, food content basically, through forcible expulsion, which we call it vomiting. The third very important disorder of digestive system which we'll be discussing is diarrhea. Now, diarrhea is also very common digestive disorder which one must have experienced in lifetime. These are very common disorders, digestive disorders in day-to-day life which one experience, and one of them is diarrhea. It is excessive and liquidity of fecal discharge. So whenever there is increase in number of fecal discharge, especially liquid fecal discharge, is known as diarrhea. Now we must know this thing that anything between any fecal discharge, non-liquid, basically semi-solid fecal discharge from 2 to 3 events of fecal discharging is considered as normal, whereas anything beyond 3 times of fecal discharging, liquid fecal discharging, is considered as diarrhea. Now diarrhea is caused by viral as well as bacterial infection. It can be caused by virus as well as bacteria. The most common bacteria are Escherichia coli, Salmonella, Campylobacter and Shigella. Now these are also MCQ questions which are asked in the competitive exams, especially NEET. Which are the bacteria which cause diarrhea? The names are Escherichia coli, Salmonella, Campylobacter and Shigella. The common diarrheal viruses are rotavirus and Norwalk virus. These are the viruses which are responsible for causing diarrhea in human. Diarrhea interferes with digestion and reduces the amount of food absorption. Now, what is the concept behind diarrhea? That diarrhea will interfere your digestion, your digestive system, the functioning of the digestive system, and will reduce the amount of food absorption, the nutrient, the vitamin, and ultimately causing extreme dehydration in the body. As we had discussed earlier, that diarrhea causes extreme dehydration into the body because of the less absorption of water and food in our body. So excessive loss of body fluid may result in dehydration. ORS, which is popularly known as oral rehydration solution, provides protection from the dehydration. Another very important digestive system disorder which we'll be discussing here is constipation. Again, it is a very common disorder. It is characterized by the following conditions: as when the feces are retained within the rectum, as the bowel movement are occurring irregularly. So in that case, the condition which is caused in the body due to retention of the feces caused by irregular bowel movement is referred to as constipation. The passage of dry and hardened feces is one of the main characteristic of constipation. So the characteristic feature which is very distinctive in constipation is the passage of dry and hardened feces. So as said, there is a passage of dry and hardened feces in this condition. So constipation may cause injury to digestive tract and produce several complications. So whenever there is passage of hardened and dried feces through the alimentary canal, it may cause injury to certain internal elements. It is generally accompanied by headache, feeling of depression, sluggishness and pain in abdomen. The common cause is reduced roughage content in the diet. So this is why a lot of intake of roughage content in diet is advised to patients suffering from constipation, because the roughage helps in clearing the dry and hardened feces. Another disorder of the digestive system is indigestion. Now the name is in itself very distinctive, indicating inability to properly digest the food. So what is indigestion? It is the inability to digest the food The first symptom of indigestion is abdominal discomfort after meal. So whenever you have meal and you feel discomfort, sudden discomfort, that is referred to as indigestion. A lot of gas or flatulence is being produced. This is the characteristic feature of indigestion. Also, there is often distension of stomach. You feel that your abdomen is distended, is full, you have feeling of fullness, and intestine giving a feeling of fullness. Indigestion is caused by the intolerance to an ingredient of food. Now, the indigestion can be caused by certain intolerances toward different type of ingredient in food, as we know that the food these days are also very adulterated. Also, the basic ingredient of the food may sometimes cause indigestion in humans. Also, defect in stomach, for example, hyperchlorhydria, or in intestine inadequate enzyme secretion. Any type of anxiety, food poisoning, overeating, or consumption of even spicy food may cause certain amount of discomfort in the abdomen, causing indigestion. So this was all for today's video. For keeping yourself updated with such more videos, please like and subscribe my channel. Thank you.